When treating the nose, always observe the skin in the upper body, especially the face. This gives information about dry, damp situations, and also if there is cold or heat in the lung. So the following table should help you recognize and treat some common symptoms associated with rhinitis. Local, distal, and symptomatic points are added to the points in the table. So so we have here 3 columns: symptom, 1 column for the imbalance, and 1 column for the points. So let's start with block nose in bed and runny nose other times, or black nose alternating with runny nose. So the imbalance is lung qi, stagnation of lung qi deficiency, and stagnation of dampness. So the points, we use bladder 13 and bladder 20. These are the back shoe of the lung and the spleen, respectively. And we use Li4 and 6, fluo point, wind elimination technique, wind elimination tonification on gallbladder 20. Now, symptom, constant runny nose, so there is lung leakage. So as you can see, both lung qi and the yin are all, there is also yin stagnation. So you have lung 1 and bladder 13, the front mu and back shoe, respectively, of the lung. Later, substitute this for lung 9, Li11, and Ren 17. Sneezing in the mornings on getting up. So as you can see from the tower diagram, the lung qi deficiency is decreased. Poor adaptation to environment changes. So we use bladder 13 and Li11. Sneezing or blocked nose early in the morning at 4 a.m. while still in bed. So we have lung wind symptoms. So here you could see wind heat and wind cold. This is an excess time for the lung, and even though this is a chronic problem, the symptoms appear conditionally at an excess time. So the points: gallbladder 20, wind elimination, tonification, Li6, bladder 66. The treatment should be given to sedate the excess aspect and tonify the deficient. Gallbladder 20, wind elimination, sedation, lung 7, kidney 10, tonification of bladder 66, sedates the lung yin. So we're talking about wind cold on the organ clock. Kidney 10, tonification, sedates the large intestine yang on the organ clock. Often, sinusitis with colored mucus may be present with blood. So here you could see qi deficiency with damp, stagnation, and intermittent heat from this. So gallbladder 20, heat elimination technique, bladder 13, Li4, bleed lung 11. Sneezing only when in contact with pollen or other allergen. Okay, there is wind heat in the lung. Okay, so points, lung 1, the front mu point, and lung 8, gallbladder 20, wind elimination, sedation technique. Okay, bronchial asthma. Have you often wondered why so many people are suffering from asthma in recent times? Patients coming with other problems for acupuncture treatment often forget to mention the fact that they are asthmatic and are on long-term steroid inhalers. No one seems to recognize the seriousness of the disease as long as they can suppress it with inhalers containing steroids or bronchodilators. There is not sufficient awareness among the patients of the adverse effects of bronchodilators on the heart or the side effects of steroids. Bronchial asthma shows that The pathogenic factor has moved to the interior as the exterior Wei Qi, or protecting energy, has been too weak. The cure would be to strengthen the lung and the Wei Qi, which is pretty much similar, as Lang Qi is our protecting energy, and reestablish the relationship between lung and the other organs of the 5 elements. So we have a simple table covering 2 types of bronchial asthma, which we shall show later. So treatment, the points are pericardium 6, bladder 13, and Dingshuan, the extra points for asthma, located Hapchun beside Du 14. These are used in both types. So we have here a table for lung wind heat type and the lung damp cold type. Okay, let's start with the lung wind heat type. Asthma is intermittent. There can be totally normal periods when the patient does not need any medication and be quite active. The acute phases occur suddenly and can be very serious, lasting a few days. Acute phase may be precipitated by allergy, respiratory infection, or emotional upset, especially anger. Acute attacks with dry bronchospasm and severe dry cough. Thin skin, less body hair. Emotionally labile with extreme manifestations of joy, grief, or anger. They can have hay fever or allergic skin problems. Now, for the lung damp cold type, asthma is constant, only better or worse periodically. On listening to the chest with a stethoscope, wheezy breath sounds and adventitious sounds such as crepitations are almost always present. Asthma may be worse in wet, cold weather and at nights or early mornings. Attacks with much wet cough and foamy mucus. Thick, moist skin, hairy. Melancholic, happy in their sweet, sad state with no changes. They can suffer from blocked nose and yin type of neurodermatitis. Okay, so for the treatment, for the lung wind heat type, we use lung 1, lung 7, spleen 10, Ren 17, tonification, and Do 20, Ren 22. Then SI8 sedation, GB38 sedation. Liver 5, the Luo point against the bronchospasm. For the lung damp cold type treatment, lung 10, LI11, stomach 40, LI6, Ren 17, sedation. Bladder 13 and 17, moxa and cupping. Bladder 17 is used only as an additional local point posterior to the lung, considering its largeness. This point has no special significance in this case. Then we do acupuncture on the bakshu point. So we have the corresponding points that we shall needle for the first day, the second day, and the third day. .5 to 1 ml vitamin B12 IM intramuscular injections given daily from Monday to Friday. 2 bakshu points daily as marked in the diagram, starting from T1 and ending at T10. After 5 days, there should be a week's break. Then another 5-day treatment can be given commencing on the Monday of the 3rd week. 2 courses will complete the treatment. This is the general concept of the treatment. In the wind heat type, it is important to tonify the general yin if there are many organs that are dry. In this case, one could use the Ren meridian, the lung 7 confluent point, and 3 points on the meridian Ren 3, 14, and 17. If there are scars obstructing the lung or Ren meridian, they ought to be unblocked. In the damp cold type, it is necessary to balance the spleen, as the dampness originates internally from the spleen. Points bladder 20 and spleen 1 can be used for this. And the patient should be advised to avoid milk products and cold raw foods. The treatments have to be given twice weekly for 4 to 6 weeks, then once weekly for 4 weeks, and then finally reduced to once fortnightly for 3 months. If acupuncture is used, other points on the skin could still be given simultaneously. Acupuncture is used daily, but the other points are not given more than twice in a week. The wind heat type of patient responds quickly and extremely well. They should be encouraged to stop regular inhalers as soon as possible, but carry them on their person. Using medication without actually needing it creates dependency, pushing the patient into the group of constant in type. The in type patient responds at a slower pace to the therapy. The acupuncture may even worsen the symptoms initially, but it makes a great difference to the results in the long term. It is very effective in chronic asthmatic bronchitis and emphysema. So if you find that a patient does not fit exactly into the yin type described in the table, then you may wish to refer to the other table.